Good afternoon. My name is Mary Von Mohr, and I am with the Florida Department of Health in Nassau County. I'm the Director of Community Health, and I'm a Public Information Officer. Last week, Nassau County Emergency Management Director Greg Foster began a weekly series to answer questions about COVID-19 as we are beginning to see the number of cases rise across the country, and we are entering the holiday season. Director Foster is out of the office today and has asked me to sit in for him. Our job at the Florida Department of Health and here at the Nassau County Emergency Operations Center is to provide you, the citizens of Nassau County, with the best and the most credible information available to us. Director Foster has also asked to make this weekly segment as informal as possible. The Health Department provides daily updates of COVID-19 cases to Nassau EM for dissemination to you. We also provide information about how you, your family, and your friends can remain as safe as possible during this time. This includes the now too familiar CDC practice and guidelines of wearing a mask, keeping your distance, practice social distancing, which is the 6 feet, and then as well, washing your hands frequently. We are trying our best to keep you updated on evolving changes to COVID-19. Dave Richardson, the Nassau County EOC PIO, is with us today. He is just off camera, as we as well are practicing social distancing, and he will ask me a couple of questions. Dave.
Thank you, Mary, for joining us. I guess the first question I want to ask, because it's always a subject that gets a lot of response. The CDC has come out with a new set of guidelines about masks.
Yes.
Can you update us and explain what that difference is and what the CDC is now saying about wearing a mask?
Yes. So previously we were told that wearing a mask was really most beneficial to keeping the respiratory droplets safe from others. You wore a mask really for others. However, now what we have learned is that by you wearing a mask, it will also benefit you. You will be protected from others. So you wear a mask to keep viruses away from others, but as well, it will protect you from gathering and being around and having access to those respiratory droplets. So it's a two-way street. It's very, very important. It's been proven. It's very, very helpful and effective. But also, once again, what you need to do is to remember to wear the mask in the safe measures, and following the safe guidelines of having it up, covering both your nose and your mouth, and having it real tight to your face. And you really want to have a 2-layer mask. We have not seen where the pull-up neck coverings are as effective. So go with the masks that are out there for purchase.
Right. So we're learning there's a greater benefit even now to wearing a mask.
Yes.
So it kind of leads us to what we started talking about last week is we're moving into fall, winter, and the holiday season.
Right.
So a lot of people are beginning to ask, what will I do about the holiday season? 50 states, all 50 states now are recording increases in positive cases across the country. We're seeing 150,000 cases, give or take, on a daily basis now. So Thanksgiving's here. Is it safe to travel? And if so, how do we travel? What precautions do we need to take?
That's a really good question. So, obviously, this has been a really hard time for everyone since March. We have to, I think, first acknowledge that the emotions inside of us are wanting us to still gather with our loved ones. However, I think the reality is if families choose to gather together, you're going to put your loved ones at risk, especially if you gather in groups larger than 10 or in close confined spaces. As well, we could see then even a worsening of the outbreak. We don't want to certainly have any of our family members or loved ones become ill. So we need to think about celebrating holidays differently this year. Our thought is this: if we celebrate this year doing it right, in the correct manner, then we'll have the ability to be with our loved ones in the future, going forward, okay? So we're going to say this needs to be a year of simplicity. It also needs to be a year of thinking about protection and doing your own part, owning it yourself, and then role modeling it and demonstrating for others how to do that. Regarding travel, you need to know that staying home is the best way to protect yourself. However, it's important that traveling, it does increase your ability to get the virus and become ill. However, if you choose to travel, you need to know that you're going to have to really wear a mask, cover both your nose and your mouth, and as well you're going to want to limit and avoid contact with people who are 6 feet in distance. Keep that distance. The other thing to keep in mind is that when you travel, you're putting yourself out into new, different environments, whether that's the gas station, rest stops, airplanes, the airport, Ubers, taxi cabs. Those are places where viruses live and thrive. So please protect yourself with the mask and the social distancing. Even if you're in the airport and you're away from others, you're in a different environment, so wear your mask.
And so we've kind of, because it's November, today's November 12th, and we're focusing on Thanksgiving.
Yes.
But that's not the only
Holiday.
that we're facing. It's
Right.
Christmas. And I don't want to throw you off base a little bit, but one of the other issues that's being discussed now on both social media, in the news media, is college kids. We saw the incident in Notre Dame in the football game. Those kids are having to test before they can leave campus. That's an issue for the holidays about kids coming home. I assume everything we're saying applies to those kids too, right? The college kids that would possibly come home for the holidays.
Yes.
They have to go through all of these precautions, right?
Yes.
All right. So I guess the other thing that we're hearing about is a vaccine. Does that change the way we behave now?
No. No, not at all.
All right. So are you, where are we in seeing a vaccine for anyone? Is it, next Thursday? Or are we still 6 months away for the general public to see any kind of vaccine? And if we do see a vaccine, what does it do for us? Does it change all of this?
Okay. Well, I am not the president of a vaccine corporation. I'm not the president of Pfizer, one of these companies. So I'm going to look into my crystal ball, okay? And I will tell you that we would project that we'll have vaccines out in January. That is simply a projection. It is what I have been told and what I have heard. But again, that could change in a matter of 20 minutes, okay? Because we are not at that level in Nassau County to know those higher ups and what's projected. I do believe, though, when the vaccines come out, they'll be given first and foremost to those who are most at risk, which would be our elderly persons and our first responders.
Healthcare workers?
And that's about as much healthcare workers, and that is as much as we know currently.
Okay.
I will tell you that Nassau County has already been planning for how we will provide vaccinations through our points of dispensation, our pods, across the community. So we are already planning for all persons who live in Nassau County.
Okay, and we asked last week, how are we doing in Nassau County? Between last week and today, we had an increase in the number of cases for a couple of days.
Yes.
It's back down a little bit today.
It is.
Can you share with us any expectation of, is it going to stay in that 15, 25 range? Because we are doing a pretty good job in Nassau County.
Well, I will tell you, today we had 11 cases, new cases. The future, the numbers that we have tomorrow going forward, that is all dependent on Nassau County residents. It is everyone's responsibility to take ownership of themselves as far as their health and others, and that really means you've got to wear a mask and you've got to keep the distance, and that's to keep our numbers low, but more importantly, to keep this virus low in our community and eventually see it not here. the health department is very active in working with our community partners to provide contact tracing, lots of education, but the community owns, I think, the ability to be proactive and use preventive measures.
Okay. Thank you, Mary.
Do you have any other questions for me today?
No, I think we're out of time. We're generally going to do about 10 minutes, so
Okay.
we don't tax everybody trying to stay
Okay.
abreast of everything, because we do a lot of information.
Okay.
But we appreciate you coming in today to fill in for Director Foster, and I'm
Thank you.
sure we'll
I
chat
would
again
like
soon.
can I add one thing, please?
Absolutely.
I would like to add one thing. Today we are 14 days out from Thanksgiving. One of the best things that you can do to prepare yourself if you're going to be going to someone's home is to limit your contact with others between now and that event, okay? That will mean if you're out and about, you wear your mask. Go out only if you need to. The best thing you can do is stay home between now and then as well. If you're going to be going to someone's home, prepare your supplies. Have your supplies. Everything from something as simple as hand sanitizer, your masks, bring your own masks, bring your own supplies, and we would also encourage you to have something as simple as a way to carry your mask. Because once you take your mask off at that event, you're going to be eating, drinking, you're going to need a place to put it to keep it clean. So a simple brown bag could work. And really be selective with what you do when you go in 2 weeks, because you might need to choose to go to an outside activity. If you would like to be tested, we have 2 testings coming up next. We have a testing this weekend. COVID testing is going to be Saturday morning at the MLK Center on the island, Fernandina Beach, from 8 until 10. And then as well, next Thursday, we'll be doing testing from 9:30 until 11 over at the Journey Church, which is off of Million Concourse. Thank you, and stay safe. And by all means, if you have any questions, call the health department at 875-6100. Thank you.
All right, we're off air. Click here. All right. End.